Hi, welcome to This Week in Medicine, September 20th, 2021. Last week was a big week. Let's go. Remember, this is brought to you by Foxhall Foundation. Our book, You Can Prevent a Stroke. Our Foxhall Wellness Center is open. We had a great grand opening with demonstrations, and nutrition will be coming soon. And we have yoga classes and a variety of martial arts classes. So what bothered you this week? What was in the inbox? The biggest one was probably the booster panel discussion Friday. The FDA Advisory Panel released their findings about the Pfizer booster because Pfizer submitted a request to FDA. Moderna also recently submitted a request, so hopefully that will come in a couple weeks. Still questions about the flu shot. Please don't get the flu shot now. Vaccine for kids was a big announcement today. We'll talk about that. There's still doctor and nurse burnout, so it is hard to get doctor's appointments in the area, and the emergency room is still full. A lot of people were asking questions about air travel and air safety this week. What mask do I wear? I really do recommend the KN95 or the N95, and still think about wearing some protective eye gear when you're on the airplane. It still pays to be safe in air travel. We talked about that study last week about the airplane from 1977 that lost its air circulation, and one person infected a lot of people on board the plane. So air safety is really still very important. How to interact with unvaccinated, I got a lot of questions about that. It's still really hard to do that safely. So I think until we can get the rest of the country vaccinated, or at least large portions of the country vaccinated, events where you have mixing of unvaccinated people and potentially people who don't wear masks is a big problem. So there was some good news, so let's start with the good news. This was sort of under the radar screen this week, I think, but WHO, in their weekly report that comes on Tuesday, so we'll see if this comes out tomorrow with consistent messaging, that we finally had a substantial decline in cases, in the first decline in more than 2 months. So first decline globally in COVID cases. This is great news. Let's be happy about the COVID incidence cases going down. We'll see what happens tomorrow in the WHO report. I want to remind you from last week, we had these slides about Delta infection for hospitalization rates and urgent care and ER visit rates. How successful are our vaccines? Pfizer's still great. Moderna's still great. Remember this from last week. These are great vaccines. Flu shot at most gets us 60% protection, and we've probably all been doing the flu shot as long as we can remember. So even flu shot rates aren't as successful as these vaccines. And in fact, J&J is probably as successful as a flu shot. Delta infection for urgent care visits or ER visit rates for the vaccinated. What's the breakthrough protection? Moderna again leads the pack, very good. Pfizer still very good. So even though we only had from Friday an FDA advisory on a Pfizer booster, do you really think Moderna needs a booster? If you're a Moderna vaccinated patient and you looked at the previous slide on hospitalization and this slide on urgent care and ER visit, your protection is still excellent. So the FDA Advisory Panel report, this is what showed up in the New York Times. Not needed for most, the key panel says. So it makes it sound like maybe the FDA Advisory Panel didn't think that most people need this booster shot. It is suggested for people over 65 at high risk and in healthcare fields. Then when you look at the Washington Post, same day, same story, the FDA Advisory Panel. It's a more positive spin and endorses vaccine boosters for some. The Washington Post, again, was pretty positive about it. Gave the Biden administration what they wanted. I thought we were getting the vaccine, not the Biden administration, but I guess we're seeing this in terms of what we're doing for the White House, not for the American public. The same thing with the New York Times. This story was a spin on how the Biden administration and the White House were rejected and that they wanted to, in their coronavirus strategy, get as many people vaccinated as possible. And I think to be fair to our government, they're trying to do what's best to protect as many people as possible. So I don't think this was a defeat to the Biden administration. I think this was a victory for all of us because science is winning. PBS NewsHour, though, persisted in spinning this story in a way that really focuses on the White House and the Biden administration, calling it a stinging setback. I don't think this is a stinging setback. This is a great thing that people who got a Pfizer booster have now been advised by a scientific advisory panel that they could get another shot and increase their protection. So I'm less worried about the White House and their stinging setback and the heavy blow to the Biden administration. I think we all need to be very happy that we have an effective FDA advisory panel that looked at the data and gave us a sound analysis. This is what they are supposed to do. Los Angeles Times called it a striking rebuke. So the Biden administration has been rebuked again. I think what happened was we were given an FDA advisory that said a booster shot for Pfizer recipients is a good idea. Top doctors say not so fast to Biden's booster for all plan. I don't think this was a well-developed plan. I think this was just a statement that the White House was releasing to say that it would be a nice idea if we got boosters. So I don't think we need to take this as a rebuke of the White House. I think instead we should take this as a victory for science. This is exactly what we want our FDA to be doing. So if you want to read the recommendations from the advisory panel, probably Pfizer, the company that makes this vaccine, is one of the best places to read it. But of course, they spin it in an entirely different way. There's unanimous approval for the plan to give it to people over 65 and older. So long story short, if you're over 65 and you had the Pfizer coronavirus vaccine, you can get a booster 6 to 8 months after your second shot. And then if you're in a high-risk category, like you're immunocompromised or you're a healthcare worker, you could also get a booster. Keep in mind, though, and I said this last week, but I don't know for sure if everybody caught it, Pfizer gave shots in arms to volunteer subjects last month for a new Pfizer vaccine, which is aimed at the Delta virus specifically. So that booster shot already was given to test patients last month, and hopefully that data will be out in another couple of months. So we should have a new, different Pfizer vaccine that's aimed at specifically the Delta virus. And then finally, if reading the New York Times, Los Angeles Times, NPR, and a NewsHour was not enough for you, you could get Nicki Minaj's advice on whether or not to even get a coronavirus vaccine. This is just absolutely ridiculous. We have to consider our sources, and even though many of our sources are the media does encompass Twitter. And so in this Twitter announcement, we were told by Nicki Minaj that maybe we should not get the COVID vaccine because it could affect your fertility. It does not affect fertility. So some people need to learn how to stay in their lane, and I think in this case, this is one person who needs to stay in her lane and not wander into the lane of coronavirus vaccines. There are also doctors who veer out of their lane, so this is not just isolated to people in Hollywood. Radiologists and cardiologists, we may remember, were advising on viral pandemics last year. They're not trained in infectious disease, nor are they particularly trained, all of them, in medical statistics, and they're not trained in vaccine epidemiology. So even though people lack patience with the CDC and the FDA, this past Friday they demonstrated they are doing their job. We need to let them do it. Also, this week was an interesting tweet storm that came out of an article that was published on WebMD. The article was an analysis of the vaccine adverse effects reporting system, VAERS or VAERS. This is a reporting system where if you have a side effect to a vaccine, you can list it, and that forms a database. So two people took a look at that database and drew some conclusions on pediatric myocarditis from the Pfizer vaccine. That research was somewhat roundly criticized. Again, you have to consider the source. This is WebMD. The people who published this study were not necessarily grounded in medical statistics and vaccine science. So again, there are even doctors who veer out of their lane. And this story this week about myocarditis from the Pfizer vaccine was definitely a demonstration of physicians who are veering out of their lane. Also, the media veers out of its lane, and you know this because we've talked about it at your doctor's appointments. Be careful what you read about when you should take your medications, aspirin, proton pump inhibitors, statins. Remember, these are media journalists, not necessarily your personal doctor telling you to do this, and they're not necessarily the most weighted opinion. These are not peer-reviewed articles. These are articles written in your local newspaper. So be careful. Make sure that these journalists are not veering out of their lane as well, giving you medical advice that is not particular to you. So the overall message, stay in your lane. If you're in Hollywood, stay in your Hollywood lane. Make movies for us, entertain us, but don't necessarily give us advice on whether or not we should be taking a coronavirus vaccine. FDA, let them do their job. CDC, let them do their job. They demonstrated this past week what their job is. So if we all stay in our lane and do our job, I think we'll continue to get very good advice on how we should live through this pandemic. Good news today was Pfizer for kids. Pfizer sent in to FDA a clinical trial of a robust immune response by vaccinating kids 5 to 11 with a third of the dose of the Pfizer adult vaccine. So children were given a third dose, not the full dose, but a third dose of the Pfizer vaccine. That data has been submitted to FDA, and they think that the analysis at FDA could be out by the end of September, maybe October. We'll have a vaccine for kids. So this is great news for everybody who has kids in school who are worried we may have a vaccine for you pretty soon. Tony's tip of the week, set up your own Quest Lab account. If you set up your own Quest Lab account, it's really pretty easy. You can get your lab results fast. So you just do it like you would do any other account for yourself. This is the web page. You can go to myquestdiagnostics.com, go to create an account, create account, type in your username, make yourself a password. Obviously, you haven't made a username or password yet, so don't click sign in, type next. And then there are just 3 more steps. Tell us more about you, your name, Nicki Minaj, for example. And then set your password, and this way you can get your own laboratory test results. Not that we mind fielding your phone calls, we don't. But if you want to get your Quest Lab results soon, this is a way that you can do it. You can also do this with LabCorp. If you have a LabCorp account, I have a LabCorp account. It's a little bit harder to access, but you can also do this with LabCorp. We wanted to introduce a concept that Dr. Yamamoto has called genetic metabolic matching. So this is just an introduction today. We'll get more in depth in later weeks. It's about potentially eating your food and your diet relative to your ancestry and your genetic background. So for example, we all know that Asians eat a lot of rice. Is there a reason in genetics that they do? Is there a reason that some people in Ireland eschew gluten? Yeah, because there's actually a lot of genetic celiac allergy or gluten allergy in some areas in Ireland. So there are genetic factors that influence what we can eat, and maybe we should be doing that a little bit better, analyzing our background, what we know we can eat, what we know other people in our family can't eat. It's similar with medications as well. If you know someone in your family does well with a particular medication, you may also metabolize that medication well. Some examples of this are alcohol sensitivity. Some people in Asian cultures do not metabolize alcohol very well, and that has to do with decreased alcohol dehydrogenase. There are some acquired allergies that may have a genetic basis. Alpha-gal is an allergy to red meat that you can acquire after you get a bite from a Lone Star tick. That probably has a basis in a genetic predisposition. Tree nut allergy and oral allergy syndrome are also genetically based. There tend to be families that will have these allergies. And finally, lactose intolerance does seem to run in families. But if you can't eat lactose, eat dairy products, or drink milk, you need to get those nutrients, calcium and vitamin D, from other areas. So there was one article this week I thought was pretty easy to read and interesting. We've all thought about reintroducing certain foods into our diet, like eggs. It used to be that eggs were demonized for causing high cholesterol, but gradually we've been bringing them back in as a healthy protein source. Another thing I thought we could look at was rice. Rice used to be demonized as a cause of diabetes, but you don't necessarily see an epidemic of diabetes in Asian countries, but you do here in the United States. And our diet is not heavy in white rice, but Asian diets are heavy in white rice. So this was an interesting analysis, this very easy to read article, comparing the content of brown rice as far as calories, carbohydrates, and fiber to white rice. It's an interesting article if you have time to read it. It's in Eating Well. Talks about the benefits of eating rice in particular because you can mix rice with other proteins, and mixing it with fish and meat actually ends up making a pretty healthy meal. Fast pitch, I'm just going to remind you of what we talked about last week. Try to get your flu shot in October or November because the peak activity of a flu shot is 100 days after you get it. And our epidemic flu season here starts in January and February, not right now. We don't tend to see influenza in large numbers. You might see breakout cases locally, October, even now, but that does not represent our annual epidemic. Our annual epidemic really is in January and February. So if your flu shot only lasts 100 days, it's not going to cover you for February. Don't do a mammogram. If you do get a Pfizer booster, don't do your mammogram a month or two after your Pfizer booster. Data will come soon on the Moderna booster as well. We'll have to wait for that though, because the submission to FDA for a Moderna booster, remember those slides that had a high rate of Moderna protectiveness? The Moderna booster is supposed to be a 50% shot. So just like we're going to decrease the potency of the Pfizer injection for kids, the Moderna booster is supposed to be 50%. Also, it's not too early to book your physicals and take a look at your end of the year flexible spending accounts. We talked about the pyramid of health last week. We're developing this and working on it as a way of building your foundations for health for the future. But as I reminded people in the talk we gave at the opening, if you miss one important piece of the pyramid, like your COVID immunization, your pyramid will tip over. And all that hard work that you have put into your body and your health and your diet and everything else in this pyramid will simply fall over if you don't get that COVID vaccine. I don't think I need to preach to the choir, because I think all of you have gotten your COVID vaccine. So good job. And that's the end for this week.